So the project came about because we were identifying an increasing number of pressure ulcers being reported incorrectly for the organisation due to the misgrading of wounds. This had the impact that unnecessary time was being spent on completing root cause analysis investigations for wounds which were not even actually pressure related. Also, community nursing by definition is a lone worker service, and so sometimes access to those support mechanisms for staff can be limited. So for instance, access to tissue viability, as one person working for the organisation, and they can have limited access to that. There's definitely a reduction in reporting errors. We can see from the DATIC system that wounds that are reported as pressure ulcers, we can very quickly recategorise or reject, once we've looked at the image on the patient's record, that they are in fact perhaps moisture lesions. They could be trauma wounds, they could be related to diabetes, skin tears, etc. So we have been able to close those down quite quickly, and that has led to a reduction in the root cause analysis investigations that the staff are required to undertake.
And from a patient view, I've been involved in 2 patients that have been very pleased about seeing their wounds and seeing the progress of their wounds. And actually we had one patient who had a healing grade 4 for 3 years, and it became very static. And we introduced taking the pictures to her, and she was quite happy with that, and she saw, and she actually said, "Oh, is that it?" And actually we healed her within a couple of months. And whether you could arguably say it's because she saw the wound and she understood it, or whether, you know, the dressings take a big factor in that. However, I think the patient herself having that understanding and seeing what was actually there, because she couldn't see where it was, her vision was this big wound, you know, on her back, but actually it was this small thing. And then I think she really understood what we were asking her to do with trying to offload and to turn to try and offload the weight to that area. It's really helpful.
Yeah, there is actually some kind of research and guidance out there that says if a patient can actually see their wound through the healing stages, they are more likely to be compliant to treatment pathways. So that was positive.
For me, being a clinician, being out there, I've done some virtual assessments with tissue viability nurse, also with Claire, which is actually, even though I am quite an experienced clinician myself, there's always something that can baffle you and you need that other expertise.
It also generates an opportunity for discussion amongst staff members around, I found this, or I saw this wound today, you know, can we have a bit of a chat about it, because I think this, and what do you think? And being able to see it just gives that opportunity to kind of have that discussion, increase that knowledge, and probably ultimately give them a bit more confidence when they're out there, because like I said, they are lone workers and their access to mechanisms can be limited, support mechanisms.